Greetings everyone and welcome to today's session of your musculoskeletal system course. We're going to be continuing with the joints of the lower limb, and similar to what we did with the hip joint, we're just going to go quickly through the general concepts. Remember, whenever you're studying joints, you need to be familiar with the bones and articular surfaces that make up that joint. You need to be able to mention what type of joint it is. You need to be aware of the ranges of motion, which direction the joint can move, what structures stabilize the joint, and what the common pattern of injury that happens at that joint is. And remember, we went through some terms that usually come up a lot when we're studying joints. These were the capsule, which was the tissue surrounding the bones that make up the joint. Remember that it usually has an outer fibrous layer, which is tough and protective, and then on the inside it's lined by a synovial membrane, which is usually smooth for reduction of friction. Remember, you have the articular cartilage, which is the cartilage that's found between the articular surfaces of the joint, and the ligaments, which are the rope-like structures that hold the bony components of the joint together. For today's session, we're going to be covering the knee joint. All right, so let's go ahead and get started with that. Okay, so this is a side view of the knee joint. Okay, and you can see that there are a number of bones involved in the formation of the knee. You've got up here, this is the femur, and you can see that the condyle of the femur is resting on the condyle of the tibia. And then you have another bone that's found at the lower end of the femur, that's called the patella. So there are three major bones that are involved in the formation of the knee: the femur, the tibia, and the patella. And of course, as we're going to see later on, there are a lot of factors that hold these bones together. And here you can see the patellar ligament, which is the common insertion of the quadriceps femoris, passing over the patella and then inserting into the tibial tuberosity. So the knee joint is formed by articulations between the lower end of the femur, the upper end of the tibia, and the patella. Please note that the fibula does not form part of the knee joint. Okay, so the fibula is involved in the formation of other joints, which we'll see later on, but it does not take part in formation of the knee joint. In terms of type, my apologies. In terms of type, the knee is a hinge type joint, and think of a hinge as basically the little metal part at the side of the door that holds it with the wall, okay? And you know how that thing kind of rotates whenever you open and close the door. So you can only move the door in two directions. They're either opening it or closing it. So that means that the knee joint usually only moves in that plane, okay, which is in the case of the knee extension and flexion, but we'll see that in a little bit more detail later on. Okay, so let's just look at the articulations of the knee. We've mentioned that there are three bones involved in this formation. The articulations that form the knee joint are what we call tibiofemoral, which are found between the corresponding condyles of the femur and the tibia. So that basically means the medial condyle of the femur articulates with the medial condyle of the tibia, and then the same thing applies for the lateral condyles on both bones. So the articulation between the femur and the tibia is referred to as the tibiofemoral articulation of the knee. Then you have the patellofemoral articulation, and this is found between the anterior aspect of the distal femur. So basically the lower part of the femur, its anterior surface, articulates with the patella to form the patellofemoral articulation of the knee. In this picture, we are going to look at the articular surfaces, so basically where the bones meet, okay? So here you're looking at the upper surface of the tibia. Here you're looking at the lower end of the femur. Okay, so you can see that the green part, which is the condyles of the femur, articulate with the condyles of the tibia, which are also colored in green, so that you can figure out that these two kind of sit with each other. Okay, so these are the where the tibiofemoral articulation takes place. And then this red surface here, this is where the patella sits on the lower end of the femur anteriorly, and this is called the patellofemoral articulation or patellofemoral surface. So we already mentioned that the knee joint is a hinge type joint, meaning that it usually moves in, and when we say move, I mean move freely in one plane, okay, which is its ability to move in flexion and extension, okay? With flexion, you're basically lifting your foot off the ground and then moving your leg backwards. So this is flexion of the knee. Whenever your foot is sitting flat on the ground and then your leg is completely straight, this is referred to as extension. So flexion is moving it backwards, extension is making sure that it's straight. Okay? With this picture on this slide, you can see that the foot has been lifted off the ground and then there's slight flexion of the knee happening. And then it's showing you how there is a little degree of outward rotation and inward rotation happening in the leg. So basically the foot is being twisted either to the outside or the inside. So being a hinge joint, the main movements that happen at the knee are flexion and extension. Flexion is a function mainly of the hamstrings. The gracilis, sartorius, and popliteus also assist with this action. With extension, this is a function of the quadriceps femoris, which were the muscles of the anterior compartment of the thigh. Medial and lateral rotation, which was the outward and inward rotation, can only occur if the knee is flexed, okay? Meaning that you have to put the knee in a certain position before you can perform this action. And then that would only be in special or specific circumstances if that movement is needed. So the main motion that happens at the knee is flexion and extension. The medial and lateral rotation are just extra movements that happen if the knee is flexed. If it's not flexed, then we don't consider them as actions of the knee. Okay? Now, generally remember the capsule is the tissue that surrounds the bony components. It is wide and lax, so it means that it is not tightly attached to the bone, to the bony surfaces. Okay, so it's a little bit relaxed, and it's usually thick on the posterior surface. In terms of attachment, the capsule is attached to the intercondylar line of the femur, and it's attached to the tibial tuberosity, which allows it to cover most of the components of the knee joint. And like I said, it's lax, okay, so that allows for a bit of free movement within the knee. Okay, now there are specific cartilages or articular cartilages that are found in the knee, and they are called the menisci. Now, what we're looking at here is, again, the superior surface or superior aspect of the tibia. Okay, and these are the two condyles. You've got the medial condyle and the lateral condyle here, and then this is the intercondylar area. So you can see that on the superior surface there are C-shaped cartilages found on either side of the tibia or of the tibial condyles. Okay, and I'm not sure if it's clear in this picture, but what they're trying to indicate here is that these menisci are deep. Okay, so they're kind of showing you how this region is dark and then it gets lighter here. They're trying to indicate that there is depth to the menisci. Okay, the idea is that this depth allows the relatively large condyles of the femur to kind of sit comfortably, kind of like a cushion. Okay, so that they can properly attach to the tibia. Okay, so the menisci of the knee joint are two pads of fibrocartilage that are found in the knee. They are the medial and lateral menisci. And if you want to talk about one, it's called a meniscus. So you've got a lateral meniscus and a medial meniscus. Menisci is plural. Okay, so they deepen the articular surfaces of the tibia, like I said, so they can allow the femoral condyles to attach comfortably. and they act as shock absorbers. So like I said, they kind of act like cushions or shock absorbers. So if there's any sort of trauma or force applied to the knee, they can distribute it and reduce the effect of that force. They are C-shaped, like I showed you in the picture, and attached to the intercondylar area of the tibia. So that means that they have an inner attachment to the intercondylar area of the tibia. The lateral meniscus does not have an external attachment, but the medial meniscus does. The medial meniscus has external attachments to the tibial collateral ligament, which we'll see in a minute, and it's also attached to the joint capsule, and therefore more likely to be torn. So that means that the inner part of the menisci, the medial and lateral menisci, is attached to the intercondylar area. Okay? However, externally, so on the outer surface of the menisci, the lateral one does not have an attachment, but the medial meniscus does. So that means that if anything should happen to the joint capsule or to the tibial collateral ligament, they can end up pulling the medial meniscus as well and causing injury to that fibrocartilage. So it doesn't have to, if the injury doesn't have to target the medial meniscus directly, it can be targeting one of the structures that it's attached to, and then the medial meniscus can get damaged as a result of that. Moving on to look at the ligaments of the knee joint. Remember, these are rope-like structures that attach between the bony components of the joint. We have what we call collateral ligaments, okay? And these are strap-like ligaments that are found at the sides of the knee joint, okay? So they're going to be found on the medial and lateral sides. These are called the tibial collateral ligament. You can also refer to it as the medial collateral ligament. Now, this is attached between the medial epicondyle of the femur and the medial condyle of the tibia. So it's going to be found on the medial side, between the lower end of the femur and upper end of the tibia. The other one, therefore, is going to be referred to as the fibular collateral ligament or the lateral collateral ligament. And this is attached between the lateral epicondyle of the femur and the head of the fibula. So this could be considered the only role of the fibula within the knee joint, is that it attaches the lateral collateral ligament. So what what the collateral ligaments do is they prevent excessive medial or lateral movement, which is probably why, or one of the reasons, that medial and lateral rotation only happen in a certain position. Okay, so they basically support the sides of the knee and prevent excessive sideways movement of the bony components. Okay, so here we're looking at an anterior view of the knee joint, and you can see that the ligaments that are labeled here in green, colored here in green, one of them attaches between the medial epicondyle of the femur and the tibial condyle on this side, and then on the other side it goes from the lateral epicondyle to the head of the fibula. Okay, so these two are the collateral ligaments that hold the knee joint at the sides. And you can also see the menisci that are found here in between the condyles of the tibia and femur. Okay, so we have another set of ligaments that you need to be familiar with. These are called the cruciate ligaments. And these are two ligaments that connect the femur and the tibia in the middle. Okay, so we've seen how the collateral ligaments attach at the sides, and we've seen how the menisci attach the two condyles together. So we're going to end up left with like this little area in the middle, sorry, between the tibia and the femur. So these two, that area needs to be connected, and they are connected by the cruciate ligaments. We have two of them, which are called the anterior cruciate ligament and the posterior cruciate ligament, based on their position. Obviously, one of them is going to be at the front, the other one is going to be at the back. Okay? The cruciate ligaments prevent displacement of the tibia from under the femur. Okay, so basically to support or to connect or attach between the tibia and the femur in the middle, okay, and then that's going to prevent the tibia from moving excessively away from the femur. So it basically holds the two together. Okay, so in this picture, we're looking at the cruciate ligaments as well. Okay, you've got the, where's my pointer? Sorry. Okay, you've got the anterior cruciate here in blue, and you've got the posterior cruciate in yellow, and you can see how they're kind of crossing over each other. Okay, that's why they're called the cruciate ligaments, because they form a cross. And like I said, they attach the tibia and the femur together, and they actually originate from the surface of the tibia and then insert or attach into the femur. So they basically prevent the tibia from moving out from under the femur. Okay, so moving on to the injuries of the knee joint, we've seen how the knee is formed by the patella, by the femur, and by the tibia. And we've seen how there are multiple factors that are holding the bones of the knee together. And we've also seen how the major movements that happen are extension and flexion, and then you've got a slight degree of rotation happening if the knee is flexed. So, injuries of the knee joint will depend on the position of the joint at the time of impact. Okay? If force is applied to an extended knee, so basically if a person is standing with the foot on the ground, this results in damage to the collateral ligaments. Okay? And if you're going to test for their damage, the patient will experience pain on rotation of the knee. The anterior, the anterior cruciate ligament is torn by hyperextension of the knee. So when you're standing, that's just regular extension. Hyperextension is basically, just think of excessive forward movement of the tibia. So basically the tibia passing its normal position anteriorly. Okay? So the anterior cruciate ligament is torn by hyperextension of the knee, or if a large force is applied to the back of a partially flexed knee. So not a completely flexed one, just a partially flexed one. So the foot is off the ground slightly. And then if a large force is applied to the back of a partially flexed knee, that can damage the anterior cruciate ligament. So think of it with like football injuries. If the player is getting ready to kick the ball, he's just starting to lift his foot off the ground, and then someone attacks him from behind. Okay? When testing for this ligament injury, the patient usually has something called a positive anterior drawer test. Okay, and I'm going to show you what that is in a minute. Okay, the posterior cruciate ligament is torn when a large force is applied to a flexed knee. Okay? Pushing the tibia backwards. So basically this is someone who has his knee flexed, so his foot is off the ground, and they're attacked from the front. So the tibia is pushed backwards, and this ends up injuring the posterior cruciate ligament. And what they have is called a positive posterior drawer test. Okay? So let's look at the drawer test.
Perform the anterior drawer test. Bring your patient's hip into 45 and your patient's knee into 90 degrees of flexion. You can fixate this position by gently sitting on the foot of your patient. Then palpate the joint line with your thumbs and try to move the tibia anteriorly in an explosive movement. This test is positive if the tibia translates anteriorly more than 6 millimeters. To perform the posterior drawer test, have your patient in supine-lying position and ask your patient to flex his hip to 45 and his knee to 90 degrees. You can fixate this position by slightly sitting on the foot of your patient. Then palpate the joint line and push the tibia posteriorly in an explosive movement. This test is positive if the tibia translates posteriorly more than 6 millimeters.
Okay, so that was the drawer test, basically testing the mobility of the tibia. Remember I said the cruciate ligament supports or attaches the tibia to the femur. So if any of those two ligaments are injured, then obviously the tibia is going to be more mobile. All right. So that's all I have for you today in regards to the knee joint. I hope that session was useful for you. And as always, I will be available for questions if you need any, or sorry, if you have any. And just a little reminder to make sure you pay attention to your actions and try to be conscious about what you're doing and do your best not to hurt people, because everything that you do makes a difference. All right, so I'm going to wrap up this video now, and I will see you guys in the next one.